Dr. Nicholas Jones, Nip and Tuck Plastic Surgery. Today we are going to talk about postoperative medications. So the postoperative medications are very important in order to control your pain and just to also just make sure you're comfortable and able to just recover in a timely fashion. And so I'm gonna just go over some medications that we commonly use. Now, this isn't for everybody because some people have allergic reactions. Some people currently take medications, and some of these medications may be contraindicated. So first and foremost, we're going to start off with pain. And for pain, what I like to do is everybody gets acetaminophen, which is Tylenol, and I like to give 1,000 milligrams 3 times a day. So even if you don't have pain, I like to give Tylenol because it just helps control the baseline pain, just give you some baseline control. Now there are patients who may not be able to take Tylenol, patients who have kidney disease or renal failure who may not be a candidate. The next medication that I like to use, we also like to use ibuprofen. Ibuprofen, which is the same thing as Motrin. We use 800 milligrams. And I typically use that twice a day. So I like for patients to alternate between the Tylenol and the Motrin. And basically what that does is it hits different pain receptors that have a better baseline pain control. Now, there is a cohort of patients who I don't like to use ibuprofen in. One, that's patients who've had gastric bypass procedures. And also, if you're a patient of mine and you've undergone abdominoplasty, I don't like to use ibuprofen and Lovenox in the same setting because there is a slight increased chance of bleeding, or just in my personal experience, I've seen patients have more bleeding. So if you're on Lovenox, no ibuprofen. Ibuprofen, Motrin, same thing. All right, next medication we have here is gabapentin. And you can see I'm covering the patient name. I don't want you to see the patient name. Gabapentin, same thing. It's also called Neurontin. And basically what that's used for is nerve pain. And so a lot of times patients undergo liposuction. And so the nerve fibers get stretched out. And so your nerves are a little irritated and you have this tingle, burning sensation. So gabapentin helps out with that. And that's usually taken 2 to 3 times a day. And I typically like to use that for about 7 days. Again, this is to hit different pain receptors to have a better control of your pain. And now we're going to go to the big boy. This is oxycodone or oxycodone. When you combine oxycodone with acetaminophen, it's called Percocet. So I like to give oxycodone, and the reason I use oxycodone alone is because I give patients Tylenol. I do not want my patients to end up having toxicity from Tylenol overdose. And typically, if you're taking too much Tylenol, you have ringing of your ears, which is also called tinnitus. You may develop headaches. So the maximum dose of Tylenol that you can take is 4 grams. And I try to stay far from that. So I have patients take like 3 grams. But the oxycodone, usually given 4 to 6 hours, and I recommend that you use it for more severe pain. If your pain isn't controlled with the baseline medications, go ahead and take the oxycodone. Now, are you going to get addicted to it? Probably not. If you're taking it for pain, you should not become addicted to it. However, some of the side effects of oxycodone is can cause you to become constipated, dehydrated. So you want to make sure you stay hydrated. And just in case, just to give you a little bit more, we use Colace or Ducasat, and this is for a stool softener, and this is strictly really for patients who are taking a narcotic. This should just help your body, help soften your stool so you don't become constipated. Again, the goal is to stay hydrated so that you don't have those symptoms. Now, however, your gut motility does slow down after general anesthesia. So I encourage, again, the patient to move around, stay hydrated. And after like 5 or 6 days, if you haven't had a bowel movement, you can either take a suppository or enema, or you can take some by mouth to help move your bowels. Another medication I commonly use, promethazine. This is Phenergan. and this is used for nausea. And last but not least, this lorazepam. We use this sometimes as also Ativan. I typically use that for my weight liposuction patients, and it's really just to help out with the anxiety. Also, just to make them more comfortable. I also use it in a setting of tummy tucks, just for muscle spasms. Now, again, these are commonly used medications. They may not be for everyone, but it's just to give you an idea of some medications that you may expect to see when you're on your plastic surgery journey. I'm sorry. So the key is make sure you read over all your instructions. Make sure you pick up your medications, bring all of them with you on the day of surgery, and make sure you inform your doctor or your plastic surgeon of any medication that you're currently taking, any allergies that you have, so that we make sure that we're doing what's best for you. And lastly, what was I going to say? Um, for those of you who have underlying medical conditions, you want to make sure you bring all those medications. If you're diabetic, you also want to inform your plastic surgeon ahead of time, because some of those medications we may want to hold the night before surgery, such as metformin. And for those who take insulin, we may end up giving you a half dose, because after being NPO, your glucose levels will be much lower, and we don't want to cause you to go into hypoglycemic shock. So thank you, and that is